Welcome back to Cancer as a Mitochondrial Metabolic Disease Basics. We have now looked at how vitamin D is made, how sunlight is superior to supplements, why vitamin D and how vitamin D kills cancer cells. But is vitamin D actually beneficial for cancer patients, or is it just another overhyped supplement? In this video, we're going to look at the evidence linking vitamin D levels to cancer risk, progression, and survival, and whether correcting vitamin D deficiency may impact outcomes. We'll go through what the research says and, just as importantly, what it doesn't say, so you can better understand how vitamin D fits into the bigger picture of cancer biology, prevention, and treatment. So without further ado, let's get into it. So as the video is titled, is vitamin D good for cancer patients, vitamin D and cancer survival mortality? So I think in some ways it's very exciting to look at all the ways that cancer is affected or is killed by a particular substance, in this case, vitamin D. But when the rubber meets the road, what actually happens when it's either deficient or when it's given? So let's take a look at that. So this is a paper that was published in July of 2020. And it's not looking specifically at vitamin D, but it's looking at sun exposure. And it says here, studies in the past decade indicate that insufficient sun exposure may be responsible for 340,000 deaths in the United States and 480,000 deaths in Europe per year, and an increased incidence of breast cancer, colorectal cancer, hypertension, cardiovascular disease, metabolic syndrome, multiple sclerosis, Alzheimer's disease, autism, asthma, type 1 diabetes, and myopia. In this paper that was published in March 2011 titled Prevalence of Serum Vitamin D Deficiency and Insufficiency in Cancer, Review of Epidemiological Literature, I've highlighted this portion here where it says vitamin D deficiency has been found to be associated with a variety of cancers, including prostate, multiple myeloma, colorectal, and breast cancer. The next paper was titled Vitamin D's Impact on Cancer Incidence and Mortality, a systematic review published a lot later in July of 2025. And it says the findings reveal a strong inverse relationship between serum 25-hydroxy, vitamin D levels, and the incidence, metastases, and mortality of several cancer types, including colon, gastric, rectal, breast, endometrial, bladder, esophageal, gallbladder, ovarian, pancreatic, renal, vulvar, and Hodgkin's and non-Hodgkin's lymphomas. It later in the paper says, sun exposure and generation of vitamin D. Despite the health benefits for safe sun exposure, generating sufficient vitamin D3 among populations has limitations. Sun avoidance can markedly reduce the dermal production of vitamin D. The Earth's atmosphere absorbs and reflects UVB radiation, leading to a lesser amount reaching the surface. Factors include sun avoidance behavior, darker skin pigmentation, time of the day, and duration of sunlight exposure. When evaluating sun exposure, the month and season are important, unless you live in the tropics. The solar zenith angle and the angle between the sun and vertical axis, particularly during the early mornings, evenings, and winter, result in less vitamin D or zero vitamin D penetrating the skin. Ecological studies have demonstrated that a significant inverse correlation between solar UVB exposure and the incidence of certain cancers and cancer-related mortality. One population-based study suggested that achieving a serum 25-hydroxy vitamin D concentration sufficient to reduce cancer risk through casual sun exposure would require an oral intake of approximately 2,800 units per day, perhaps an underestimation. This highlights the pressing need for public health strategies to prioritize vitamin D sufficiency. By addressing the challenges posed by sun exposure limitations and evolving dietary guidelines, healthcare systems can mitigate the prevalence of hypovitaminosis or low vitamin D cost effectively. Simultaneously, research into optimal supplementation protocols and their integration into preventive healthcare practices will serve as a crucial step towards reducing the global burden on chronic disease and cancer. So I'm just going to start talking a little bit about melanoma, because this is a topic that I think deserves its own little section of a talk like this, because the medical establishment and the powers that be have scared the bejesus out of us about getting outside without a ton of sunscreen or a big giant hat. So let's take a look at this paper that was published in December of 2019. It's titled Severe Vitamin D Deficiency Associated with BRAF Mutated Melanoma. It says overall, 104 patients, 84% of those diagnosed with melanoma were considered deficient, of which 31% were considered severely deficient, probably single digit. 4 patients were classified as stage 0, 18 patients were classified as stage 1, 7 were classified as stage 2, 16 were classified as stage 3, and 79 were classified as stage 4, which end up making 64% of patients with stage 4 melanoma. 87% of those had vitamin D deficiency. So let's unpack that for a second. People who have melanoma would be thought of as people who are over abusing the sun, people who are being outside all the time, burning themselves to a crisp, right? What this is showing is that people who are diagnosed with melanoma, 84% of those people vitamin D deficient, which means they're not getting enough outside to raise their vitamin D level to a sufficient status. And they're not supplementing to make up for whatever they're not getting from the sun, right? And then if you were to look at the people who had the worst prognosis, people who have metastatic or stage 4 melanoma, 69 of the 104, or 87% of those were deficient in vitamin D. Let's take a look at the next paper, published in January of 2017, titled Vitamin D Deficiency is Associated with a Worse Prognosis in Metastatic Melanoma. So it says here, a worse melanoma prognosis associated with vitamin D deficiency is indicated by a higher stage, ulceration, and higher mitotic rate. In patients with stage 4 metastatic melanoma, vitamin D deficiency was associated with significantly worse melanoma-specific mortality. It increased your risk of dying by 206% compared to those who had at least sufficient vitamin D. Maybe not even optimal, just sufficient. Patients with metastatic melanoma who were initially vitamin D deficient and subsequently had a decrease or less than 20 nanograms per milliliter, which is severely deficient, increase in their 25-hydroxy concentration had significantly worse outcomes. So basically, if you had metastatic melanoma and you're deficient, you have a 200% more likelihood of dying. But if your vitamin D level is less than 20, severely deficient, you have a 468% more likely to die of metastatic melanoma just from looking at vitamin D. So what happens when vitamin D is actually given to patients? We're going to look at what the published literature shows us. The first paper we're going to look at is published in April 9th of 2019, and it says the effect of high dose versus standard dose vitamin D supplementation on progression-free survival among patients with advanced or metastatic colorectal cancer, the Sunshine randomized clinical trial. And it says here for median progression-free survival, high dose vitamin D was 13 months versus 11 months for the standard dose. So both groups got it, right? They either got 4,000 or they got 8,000. That's high dose versus low dose. So just doing from 8,000 to 4,000 increased your chance of having a time without progression, right? 13 months versus 11 months. And then later it says for standard dose vitamin D, multivariable hazard analysis for progression-free survival or death was 0.64. That means that just giving these patients with metastatic colorectal cancer 4,000 units, because it's a standard dose, right? It decreased the chance of dying of that cancer by 36%, just giving 4,000 units. Next paper, published in November of 2020, the effect of vitamin D supplementation on survival in patients with colorectal cancer again, systemic review and meta-analysis of randomized controlled trials. It says here that while trials varied in inclusion criteria, intervention, dose, and outcomes, meta-analyses found a 30% reduction in adverse colorectal cancer CRC outcomes with supplementation, decrease your risk of an adverse effect or death by 30%. A beneficial effect was seen in trials of colorectal cancer patients, progression-free survival decreased by the 35%. And in cases of survival, in this particular meta-analysis, it showed that it decreased your chances of dying from metastatic colon cancer by 24%. It later says here in the discussion, we found that a supplementation imparts a 30% reduction in adverse survival outcomes overall, and a 24% reduction in colorectal cancer specific death, and a 33% decrease in progression or death. We included 3 population trials totaling almost 65,000 patients in our meta-analysis. So this was a big meta-analysis, and it showed a 24% reduction in mortality when they looked at these 65,000 patients. And in the prior study in 2019, this was a specific randomized controlled trial where they got a 36% reduction in death from this metastatic colorectal cancer group. Let's keep going. Next paper, titled Vitamin D Supplementation During Neoadjuvant Chemotherapy for Breast Cancer Improves Pathological Complete Response, a prospective randomized clinical trial. And it says here, in the multivariate analysis, factors significantly affecting complete response were vitamin D intake. And it showed that if these people got an oral vitamin D3 supplement of 50,000 units per week, it increased their chances of a complete response by 233%, or an odds ratio of 2.33. Astounding. Next paper, published in March of 2025, Impact of cholecalciferol, or vitamin D3 supplementation on radiotherapy outcomes in advanced cervical cancer. And it says here the complete response rate was 82.61% in the treatment group versus 64.8% in the control group. The treatment group had a higher average serum cholecalciferol level after completion of the protocol. Conclusions: supplementation with 10,000 units of cholecalciferol among advanced stage cervical cancer patients undergoing radiotherapy treatment resulted in improved therapeutic response and maintaining serum cholecalciferol levels, which may further benefit cancer-free survival. Again, these people got supplemented. The treatment group received supplementation with 10,000 units of vitamin D3 daily for 7 weeks during radiotherapy and for 12 weeks during the post-treatment follow-up period. So they got it for several months, 10,000 units per day, and it increased your chance of having a success with radiation therapy from 64.8% all the way up to 82.61%. Next paper, November of 2023. Systematic vitamin D supplementation is associated with improved outcomes and reduced thyroid adverse events in patients with cancer treated with immune checkpoint inhibitors. Results from the prospective Providence study. And it says here in the abstract, I had to split it up because it was a very tall abstract, compared to a retrospective control group of 238 patients without systemic vitamin D repletion, Providence cohort 1 showed an overall survival, OS, with a p-value of 0.013, significant time to treatment failure with a p-value of 0.017, and higher disease control rate with a p-value of 0.016. The inverse probability of treatment weighing fitted multivariable Cox regression confirmed the significantly decreased risk of death at hazard ratio 0.55, which means a 45% reduced risk of death if they got supplemented versus not supplemented, and a treatment discontinuation of 60.61, which means that of the people who had checkpoint inhibitors, they didn't have to discontinue the drug in nearly 40% of cases compared to the standard treatment because of these reduced risk of adverse effects, specifically these thyroid reverse effects. So if these folks got vitamin D during their immunotherapy, it decreased their risk of dying by 45%, but it also reduced the risk of thyroid-related adverse effects by 84% compared to without getting vitamin D. And I pulled kind of some more data that came from this paper. It says all centers participated in cohort 2, while only 2 centers participated in cohort 1. In each cohort, patients were stratified according to vitamin D serum levels into an adequate group, 30 or greater nanograms per ml, insufficient 20 to 30, and deficient 10 to 20, and severe deficient less than 10. At enrollment, vitamin D supplementation was systematically offered to patients starting within 28 days from their assessment, following the guidelines of the Italian Society of Osteoporosis, Mineral Metabolism, and Bone Metabolism as follows. Adequate group got no vitamin D. So this was not just about giving the vitamin D. It was about, do they have adequate or non-adequate vitamin D levels? So if you had adequate vitamin D, they didn't even supplement with you. If you had less than 30, they got a loading dose of 300,000 units, and then they got a maintenance dose of 820 units daily of vitamin D3. If they were deficient, this is where it gets crazy. If they were deficient, and what they meant by deficient is less than 20 and greater than 10, which is crazy low, they got 600,000 units of D3 loading dose and then a maintenance of 1,000 daily. And this is what really got me. If they were severely deficient, less than 10, then they got 1,000,000 unit loading dose of vitamin D and then a maintenance dose of 2,000 units per day. That is insane amounts of vitamin D. But it also had a 45% decreased risk of death by doing that, and it decreased adverse effects by 84%, which is pretty awesome. The last paper I'm going to pull for today is titled Higher Serum Vitamin D Concentrations and Supplementation Were Associated with Improved Survival Outcomes and Treatment Response in Cancer Patients Receiving Immunotherapy, a Systemic Review and Meta-Analysis. This was published in September of 2025. And it says higher vitamin D concentrations was associated with overall survival, hazard ratio of 0.47, and progression-free survival and event-free survival, and objective response rate. That is a overall survival improvement of more than 50%, 53% to be exact. All included patients with solid tumors received immune checkpoint inhibitors and showed positive effects with higher vitamin D. Furthermore, A significant correlation was observed between vitamin D supplementation and prolonged overall survival by 0.67, which is 33%. Higher vitamin D concentration and supplementation demonstrated improved treatment outcomes to immunotherapy in cancer patients. So let's go back to our first slide. Is vitamin D good for cancer patients? I think it's probably a good, better, best, right? You have a vitamin D level that is lower than 30, you're likely going to benefit highly. The lower the number, the more you're going to benefit. If you supplement at all, as you can see, there seems to be a benefit, even with just giving pills or supplements or injections of vitamin D. Do I believe by looking at data like this, the insufficient sun exposure, because I know that this is not looking specifically at vitamin D, this is looking at all of the other benefits that are associated with the sun. I think that, as always, the sun is the best way of repleting and maintaining your vitamin D levels. Do I believe that if there's no way for you to get vitamin D from the sun or from artificial ultraviolet exposure, that if the last resort is getting vitamin D, you're going to get a benefit? I think it's very clear that you're likely going to get a benefit based off all of this data. It doesn't matter really what kind of cancer it is. There is a benefit, and it's a significant benefit. If you like videos like this, please like, share, and subscribe. And until next time.